Welcome to the healing paradigm.
Have you ever thought you had acne, spent tons of money on products only to realize it wasn't acne at all? Well, today I'm revealing one very common skin infection that might be causing those bumps. It's called bacterial or fungal folliculitis. That's inflammation of the hair follicle. Now, if you have these tiny red itchy bumps or even painful hard ones that seem to be stuck around for weeks or months, you might have folliculitis. And it's not what you think. In fact, dermatologists often misdiagnose this condition, making patients waste time and money on the wrong treatments. So let's dig into what folliculitis really is, the different types and how to treat them effectively so you don't fall into the same trap. First off, let's start with the basics. What is folliculitis and what causes it? Well, as I mentioned before, folliculitis is a skin condition that causes inflammation of the hair follicles. Hair follicles are the root of each hair on your body. And when they become infected or inflamed, they can form these small red bumps. But here's the catch, there are two main culprits behind these infections. One is bacteria, particularly Staphylococcus aureus, and the other is a type of yeast called Malassezia furfur, also known as Pityrosporum. Got that? Okay, moving on. So how does one get folliculitis? Well, bacterial folliculitis is often caused by direct contact with contaminated surfaces or sharing personal care items with someone who has it. It can also thrive in places with friction or pressure like your armpits or groin area. On the other hand, fungal folliculitis is more common and often triggered by things like sweating or using harsh skincare products. Now, despite both types causing similar symptoms and looking pretty much the same, they require different treatments, and understanding which one you have is crucial. But how do you tell the difference between bacterial and fungal folliculitis? Here's a quick breakdown to help you spot the signs. With bacterial folliculitis, you're likely to see red pus-filled bumps that might be painful to touch. They can be localized in one area or widespread across regions of the body like your face, neck, shoulders, or upper back. These bumps can also look like pimples or boils and are usually more severe. On the other hand, fungal folliculitis tends to manifest as itchy, small, uniform bumps that appear in clusters. These tend to be more numerous and are often found on parts of the body that sweat more like your chest and back. So if you're scratching your head because you can't quite tell, don't worry. I've got an easy trick for you. Let's dive deeper into the details. First, check if it's itchy. If it is, chances are it's fungal. Second, examine the size of the bumps. Are they small and uniform or larger and pus-filled? Small and uniform suggest fungal, while larger and pus-filled points towards bacterial. Lastly, consider the location. Are the bumps mainly on areas that sweat like your chest and back? If so, you're likely dealing with fungal folliculitis. Now, while these guidelines can be super helpful, remember that skin conditions can be tricky and vary from person to person. Plus, some folks may experience both types simultaneously, making diagnosis even tougher. So if you're still unsure, don't stress. The best approach is always to consult a healthcare professional for an accurate diagnosis and personalized treatment plan. They'll be able to examine your skin, ask about your symptoms, and potentially perform tests to determine the underlying cause. And this is essential, because treating them the same can actually make things worse. And speaking of treatment, what's the best way to tackle this pesky problem? Well, the key is to identify the type of folliculitis you have and treat accordingly. Because remember, we've got bacterial and fungal. So for bacterial folliculitis, your dermatologist might prescribe topical antibiotics like mupirocin or benzoyl peroxide. These are applied directly to the affected area and work to kill off the Staphylococcus aureus bacteria causing the infection. On the other hand, if it turns out that you're dealing with fungal folliculitis, antibiotics won't do the trick. Instead, your dermatologist will likely opt for antifungal treatments. These could come in the form of creams containing ingredients like ketoconazole or itraconazole. For more stubborn cases, they might even prescribe oral antifungal medications like fluconazole. But why is folliculitis so often misdiagnosed as acne? Well, the similarities in appearance can be deceiving. Both conditions present with bumps on the skin. However, as we've discussed, the underlying causes and treatments differ significantly. Many people, including healthcare providers, may jump to the conclusion that it's acne because of its prevalence. After all, acne is one of the most common skin conditions out there. This often leads to treatments with topical creams or oral medications used for acne, which can be ineffective or even worsen folliculitis. For instance, benzoyl peroxide, a staple in many acne treatments, is actually more suited for bacterial folliculitis rather than acne. Conversely, if someone with fungal folliculitis is prescribed antibiotics instead of antifungals, it won't just be a waste of time and money, but can also lead to antibiotic resistance. This happens when bacteria develop the ability to survive exposure to antibiotics, making future infections harder to treat. So what should you do if you suspect you might have folliculitis? Well, here's a simple two-step approach that can make a world of difference. First, don't just take their word for it. Ask for a culture. A simple swab test can provide definitive answers, guiding your dermatologist towards the right treatment. Second, focus on treating the cause, not just the symptom. This means if you have bacterial folliculitis, you'll need antibiotics to eliminate the infection. And if it's fungal folliculitis, antifungals are the way to go. Don't settle for symptom relief. Go for a lasting solution. Because let's face it, nobody wants to be stuck in a cycle of ineffective treatments. By taking these steps, you'll be well on your way to clearer, healthier skin, and hopefully put those frustrating bumps behind you. Remember, knowledge is power when it comes to your health. So keep learning, stay curious, and never stop advocating for yourself. And if you're still not sure what type of folliculitis you have, don't worry. Check out my next video. I'll post it up right here, and it'll help you figure out exactly what kind of folliculitis you have. Thanks for watching, and see you next time.